Good afternoon, everyone. Welcome to today's webinar. My name is Keelan Burke. I'm with Retail Excellence now 11 years, and delighted to join you for today's webinar. We've got a very important topic of health and safety and the latest updates and trends and advice. Very hot topic. We're joined by Eamon Condell of SeaChange, Head of Business Development, SeaChange. SeaChange are a really interesting company. They're super knowledgeable in health and safety. They've been our partners for, I don't know, 6, 7, 8 years now. They won Supplier of the Year, which in 2020 as part of our awards for all their interesting work in health and safety. They've got a lot of cool tech. They've got a very good app for tracking slip trips and falls and all that. So definitely a good company to talk to if you need advice. And Eamon is with me now. He's just going to flick on his camera and we'll hand over to you then, Eamon.
Hi, good afternoon, guys. I hope everything is functioning okay.
Yeah.
Keelan, thank you very much
Eamon.
for the invitation and the opportunity today to have a chat with the members. Obviously, just like to take the opportunity to thank Retail Excellence Ireland today. Obviously, health and safety is a very interesting topic. I hear you say, but we'll make it a little bit more interesting for you guys today. So today we're going to center on making health and safety work for you. So I suppose the SeaChange an overview. So first of all, SeaChange is an NFP company. I suppose what does that mean? Going back through our history, we were founded in 2005. It was a family-based business. We're based in Naas, County Kildare, for anybody that doesn't know. And we actually center on behavioral change and safety culture within the workforce. Our aim is to provide a world-class safety system and to provide an excellent risk management consultancy service. We have innovative partnerships. We provide expert services and lean systems. I suppose obviously Retail Excellence are one of our main partners that we've worked with, as Keelan said, for about the last 8 years. We offer proprietary solutions and software IP such as our Check and Inspect application, our Kego software, which I'll go through with you later on. We actually won an innovation award back a few years ago in relation to Check and Inspect and Kego. We have about 24 core staff, plus we have a global reach through our licensed partners. Obviously, being an NFP company, our reach now extends worldwide. NFP are based in Birmingham in the UK, but NFP have recently been bought by Aon. Now, you might know Aon as an insurance company, so they're essentially our parent company now, which gives us an access to an awful lot of markets. As Keelan referred to, we were awarded Retail Excellence Ireland Supplier of the Year in 2020. Across our expert team, our consultancy team, we've over 175 years experience. We're proud to say we have a 95% plus client retention rate. We service about 1,300 client sites across the globe. And in 2024, as I said, we went from a family-run company to joining NFP, an Aon company. I suppose the approach that we take is a little bit different maybe than what you would normally have within health and safety. So I suppose what we often find and what prospects and clients tell us is that they found traditional health and safety methods often frustrated people. They found them to be too generic, too linear, too top down, too once off. And the focus was, it's actually not about me. So I suppose the SeaChange approach aims to make safety personal to everybody within the business and to encourage all staff, not just employers and senior management, to bear responsibility for health and safety. I suppose we try to do that through actual practical living sessions, visual training, making it personal, and enabling routines through our Check and Inspect system so that they can engage and that they can own it. Essentially, everybody is responsible. It's not just the employer. Apologies. The first section we're going to focus on is why safety matters to you. I suppose, what is the biggest safety risk in your business? I suppose that's a question that we get asked a lot. So I suppose in the retail sector, what we always find is the biggest risks are around protecting employees, legal compliance, insurance costs, productivity, and reputation. So I suppose that's why safety matters to you. And I suppose, unfortunately, rightly or wrongly, business leaders or business owners and managers influence safety more than procedures. One thing you want to stress is that safety is not paperwork, it's leadership behavior. Now, that leadership needs to start at the top and work its way down through the core of the business. If management, CEOs, owners, senior managers, business owner operators don't take health and safety seriously, your staff are not going to take it seriously. You need to buy in from the top. I suppose workplace statistics, the real cost of an accident, is section 2. So some workplace statistics from Ireland. While many people think of construction or agri as the most dangerous industries, the reality is that businesses like hardware stores, builders merchants and other retailers face many of the same risks every day. Staff are handling heavy materials, working around forklifts and delivery vehicles, moving stock in warehouses and dealing with busy customer areas. 10,441 non-fatal workplace accidents were reported to the HSA in the most recent annual review. 688,000 working days were lost due to workplace injuries, 1.33 million days lost to work-related illness, 33 workplace fatalities recorded in 2024. Now, we do have the updated statistics there for 2025. Manual handling is the leading cause of accidents in a retail environment at the moment. That can be through inappropriate behavior by the employee, lack of training. Manual handling is still the most common reason why the HSA dispute training with employers is that manual handling, a lot of employers would say, I have manual handling done. Manual handling is only done when it's certified by someone who can issue a certificate. So we deal with an awful lot of companies who in the past would have had someone who would have came in and maybe done manual handling with their staff, but they never received a manual handling certificate. In that event, people signed to say they received a training, but if they ever had an inspection or an accident, they weren't able to produce a certificate, and that obviously led to issues. So we always say is that manual handling should be done by a certified person with the ability to issue your staff with a certificate. That is absolutely key. The breakdown in 2025 work-related fatalities by cause, the headline figure is that obviously year on year, the death toll rose from 34 to 58 last year. Now, there was numerous causes. Drowning, obviously accounted for two fatalities. Then we'd falls from height, heavy load falling on victim. That was the joint most serious fatalities that occurred last year. That was equaled by struck by a vehicle. Now, I want to refer to that struck by a vehicle. 12 of them incidents actually happened in car parks. And 2 happened in storerooms. So I suppose one thing that the HSA have found last year and are continuing to influence this year is traffic management plans on sites. They're absolutely key. Now, it's not something that the HSA would have focused on primarily previously, but last year this came to a head. Now, I'm not going to mention names, but there was a company in Westport last year and they had a fatality. It was a retail site. They had a fatality on site. Now, a lot of you may have seen that in the news, or you're feel free to look it up, but they actually had a delivery driver actually ran over a customer. That company is found to be in breach of the regulations because they had no formal traffic management plan in place for the car park. Now, I understand that traffic management plans may not apply to all businesses. Obviously, if you're in a shared space or you're in a shopping centre or something like that, you don't have responsibility for the car park. A traffic management plan may not be your priority, and obviously doesn't need to be. But just be aware that even if you have a loading bay area, that you need to have a plan to manage that area. So even though you may not own your unit or you may not operate in the car park, responsibility of loading and unloading may still fall on your door in the event of an accident. I suppose other areas there that caused fatalities was being trapped by an object, loss of control of vehicle. Obviously, that can either be a mechanical or a driver error. Loss of control of a machine, again, that can either be a manual issue or it could be maybe an operational error. And then obviously we had 2 deaths that are still to be confirmed at the time of publication. So I suppose then what we're going to focus on here is the real cost of an accident. So I suppose the direct costs are obviously our compensation, our insurance fees, and our legal fees. These can all be established and verified over time. But I suppose what we always find is that it's the indirect costs that can be as prohibitive and sometimes even more cause more of an issue to the business. So like staff absences, that may not matter if you have 100 staff working in the store, but if you're a smaller store, you've only got maybe 1 or 2 people working in a certain area, having one of them staff members absent obviously has a huge knock-on effect for staff across the board. It causes other staff members maybe to have to double job, cause resentment and cause ill feeling amongst other members of staff. Obviously, management time time. I'm sure we've all had to deal with accidents in some way, shape, or form at one stage or another, and we all know how time intrusive they are. Now, LTIs or lost time incidents accounted for 85,000 hours last year. That's based amongst our clients who we've logged with. So that's an awful lot of time that you could put into other areas of the business. And obviously, that in turn leads to a knock-on effect of less productivity as well. Reputational damage is huge. If you have an accident, obviously it makes the headlines, it might make newspapers. Obviously, it's a big knock-on effect. Public perception is massive, and especially in this day of social media, any issues that you may have from a health and safety point of view are likely to be amplified across those channels. And obviously morale as well, both amongst staff and also amongst senior management as well. If you have poor staff morale, that obviously has a knock-on effect and leads to disruption throughout the business, and that obviously affects as well the bottom line. So I suppose what we always say is an iceberg represents something similar to an accident cost. You have the tip of the iceberg, which are obviously things like medical expenses, claims, compensation. So as you can see here, the tip of the iceberg has wages paid maybe to the injured worker. We might have to pay for miscellaneous medical treatment. There might be workers' compensation payments. And then obviously we might have our insured legal services. But then, as you can see, sometimes the real cost is hidden and is actually bigger than your direct cost. So things like training costs, lost productivity from staff, cleanup and repair cost, administrative time spent dealing with that issue, third-party liability and legal costs, loss of reputation, lower morale, HSA penalties, and obviously overtime costs. So as we can see, sometimes the real cost of an accident is actually greater than the actual accident itself, and the knock-on effect can be huge. So I suppose let's run through a simple scenario here, a simple accident that may have big consequences. So an employee was walking through the warehouse when they slipped on a wet floor that had recently been cleaned. There was no warning sign in place. The employee fell heavily and broke the wrist. The injury resulted in 6 weeks off work, an insurance claim, and an internal investigation to understand what went wrong. The incident was also reported to the HSA, which led to an inspection of the workplace. What started as a simple slip on a wet floor ended up costing the business significant time, money, and disruption, highlighting how small hazards can quickly become major problems if they're not properly managed. So let's break this down. We have the 5 W's. So the 5 W's are who, what, where, when, and why. So I suppose if we look at our previous scenario, so who hurt themselves here? So the employee was walking through the warehouse, so they obviously hurt themselves. They fell. So what happened? They fell. They fell on a wet floor. So I suppose the question is there, what happened? They fell. Where did it happen? It happened in the warehouse or the factory floor, the shop floor, whatever the scenario may be. So when did it happen? It happened, say, after the floor was washed. So why did it happen? That is the crux. So by asking the 5 W's, we'll then actually find out why. So who fell? The employee fell. So what should we do? We should take their name and address, their contact details, any signs of intoxication or medical state. This also applies to any member of the public where an accident may occur. So again, now is the what. What exactly happened? So as in this scenario, our employee fell on a wet floor. So what we have to do here is detail the sequence of events, actions taken, and any contributing factors that may have led to the incident occurring. So this can be the use of CCTV, this could be the use of a witness statement, anybody who witnessed the accident, or the immediate aftermath of the incident. So where exactly did the location of the incident occur? So as you can see here, or in our scenario, it happened on a wet floor where an employee was crossing. When did it happen? Let's say it was 12 p.m. That's to establish a clear timeline and assist with the investigation. So then the why, to provide the insights into why the incident may have happened, which can include identifying potential root causes or unsafe conditions that contributed to it. I suppose here what we need to look at is why did the accident happen? So I suppose it's gone from a simple scenario where employees slipped on a wet floor to now establishing why did it happen. It didn't happen. It happened because there was no wet floor sign put up. Why was there no wet floor sign put up? Because that person who washed the floor may not have been told to do so by management or may not have received adequate training in relation to slip, trip, and fall prevention. So what we can actually break this down to potentially is that the person who washed the floor wasn't trained properly, and that in turn led to an accident that may end up costing the company thousands of euro. So as you can see, by asking the 5 W's, we actually get to the root cause of the problem and establish why it happened. So small changes that can prevent accidents. So better housekeeping. So we've all been in the scenario in the retail sector where we've had good days and bad days in terms of weather. We've all, unfortunately, due to our changeable climate, we go from extreme heat like what we have today to maybe midwinter where we have storms like Storm A1 that passed through in the last couple of years. By putting in place clear procedures, staff awareness of health and safety, and obviously maintenance, it means that we can provide a safer workplace for our employees and also for our paying customers. Most safety improvements are simple and low cost, and a lot of the time it's literally rehashing what you already have in place and ensuring that people are carrying that out. So if there's a wet floor, you make sure there's a wet floor sign. If there's windy conditions, we make sure that there's no stock loose near doors. For example, if you're operating an outside business or you're operating maybe anything where debris could fly off a shelf or something like that, we keep it inside the doors as well in relation to that. I suppose legislatively wise, where are we at? So the Safety and Health at Work Act 2005, which was amended in 2015. They understand the key provisions of the Act. We have to recognise the employer and the employee responsibilities. Employers have to promote a proactive safety culture. So that is done through the establishment of a health and safety management system that ensures your legal compliance and reduces your risk. So documentation there, which we'll touch on later, ensure that you have to have a safety statement, you have to have risk assessments, and you have to train your staff to the legal requirements, which we will step into later on. Other key pieces of legislation are the Employment Equality Act 1998 as amended, the Equal Status Act 2001, the General Applications Regulation 2007-2020, and the Disability Act of 2005. The Disability Act 2005 has led to a number of claims. This is where it merges a little bit with HR in terms of making provisions for people in the workplace who may have disabilities but are able to engage in the wider workforce. So that might be, for example, having wheelchair accessible tills to allow workers who are wheelchair bound maybe to operate a till. Simple things like that. We've had sea change, I suppose I've heard of about a dozen claims over the last 12 months, which related to the Disability Act 2005. And as I said, there is a bit of a crossover between HR and health and safety there, but them claims are unfortunately actively occurring as we speak. To dig in a little bit deeper, the 2005 Act was enacted in Ireland in 2005. It replaced earlier safety legislation. It established the framework for managing workplace safety, health and welfare of employees. It's enforced by the Health and Safety Authority, and we know them as the HSA. They have the power, obviously, to come on site and to inspect your premises. There's three main reasons, I suppose, why the HSA will call to your site. The most common one is that you've been reported to the HSA by either a member of staff or by a member of the general public. Now, our staff kind of tell us that when most of the time it will be done by either of them outlets. There is two other reasons why the HSA may call. They may conduct a general campaign specific to your in industry. We've had them happen in the grocery sector. They're currently active in the grocery sector through the southeast of Ireland and the northwest. But we do expect that to extend countrywide by the end of the summer. There's also, in relation to storage in retail sites, there is a current campaign happening for racking and safety in the workplace, work in the heights training. So that's a big campaign that's happening at the moment. Now, that is applicable to all retail sites. But what we find they are focusing on the grocery and hardware sectors in particular in relation to that campaign. And as I said earlier, the traffic management plan is another bigger piece that they are currently working on as well throughout the country. So I suppose from the retail point of view, there is probably 3 active campaigns happening as we speak.
And Eamon, just on that racking bit, is that just the safety of products up on a height, or?
No, that's the actual racking, Keelan. Certified racking your racking must be certified on an annual basis. There's only 2 companies in Ireland that currently do it. So I suppose that's something to be aware of. That is basically if something was to collapse or fall off the racking, that is the first thing that they will ask for is, has your racking been checked in the last 12 months?
Okay. And that's for warehouses with like multiple levels of racking.
Keelan, working a height is deemed anything to be once you step onto a ladder. So a foot off the ground is working a height in theory.
Really? And that has to be
Yes,
certified.
that has to be certified, correct.
Wow.
So I know an awful lot of retailers would have background storage, or maybe, they might have a room they use if it's off the ground at all. If you have one box on top of another and someone bends to lift it, that in theory is classed as being working at height because they're having to stretch. If they have to lift their heel off the ground, in theory, or take a step, that is working height.
Okay. Okay. I'll let you keep going, but we'll
Yeah,
come back.
no hassle at all. Key definitions. Employer responsibility leads to accountability. So I suppose from the employer's point of view, we can designate responsibility as employers, but we can't designate accountability. So I suppose that's a massive thing, because obviously one of the requirements that we have in the safety statement nowadays is the organizational control chart, which is a legal requirement. So in that piece, we have to actually have to outline who is the owner operator here, because ultimately they're responsible for health and safety. So even though Eamon Condell might draft the safety statement, it could be the case that Keelan Burke is the owner and he is the person who will be held ultimately responsible, and who will ultimately be prosecuted if things went that far. Eamon may be named as the person who drafted the document, but the accountability cannot change from the employer or the operator owner in that scenario. The employee is classed as persons you are responsible for. Now, you are also responsible for safety of all people on your site at any one time. So that may include any members of the public that may be in your premises at any particular time. And obviously that's where a number of claims do happen on an annual basis as well. Place of work, environment under your remit, where workers are engaged or where work is engaged. I suppose one big thing here, and this is something we've come across in the retail sector as well, again, doesn't apply much to shopping centres, but to maybe stores that are on the sides of main streets or in the retail parks. If you send a staff member outside to clean outside your premises, even if it's on a footpath or something, you are responsible for them out there. So you have to put provisions in place. Last year there was 81,000 incidents where people, non-fatal incidents were occurred. Now, I'm not saying they're reported to the HSA, but what they are is where people might have reported racism on the side of a footpath, or they may have been intimidated, and that goes under the dignity and respect at work training as well, which you're supposed to engage with as well. So just bear that in mind, that your place of work is not limited to the confines of your store. If you send a staff member outside for whatever reason, that can still be their place of work. So just bear that in mind. I suppose all control measures have to be reasonably practical. That's a big thing. So I suppose if someone like Sea Change comes out to you and asks you to do something, if it's not reasonable, or you're like, I literally can't do that, your control measures should reflect that. So there is workarounds available to everything. It's not a case of, if you bring in a health and safety company to do something for you, that they're going to force you to do something. They're not. What the HSE want to see is what's reasonable and what's practical in this situation. And if you cannot remove the risk, then all you can do is make that environment as safe as is possible. Hazard obviously is anything that has the potential to cause harm, and risk is the likelihood of an occurrence and its consequences as well. So I suppose general duties of the employer: to ensure the safety and health and welfare of work of their employees, to manage and conduct work activities in such a way to ensure that all workers are safe, to manage and conduct work activities to prevent any improper conduct or behaviour likely to endanger employees. The ultimate aim, obviously, is to provide a safe, risk-free place of work, to have a safe means to access to and exit from it, and that plant and machinery that are safe and pose no risk to any public health. To ensure safety and prevention of the risk arising from the use of articles or substances, or the exposure to noise, vibration, radiation, or any other ionizing agent. Again, retail-wise, it's noise and vibration is actually the biggest causes of issues. What I would also say to people as well, because again, there is a number of complaints made to the HSA every year over this. If you have any flashing lights in your store, or bulbs that are maybe blinking, get them changed as soon as possible. We had 2 cases last year amongst clients that didn't change the bulbs, and 2 people claimed to have epileptic seizures as a result. So simple things like that can cause big issues, because again, if we don't defend it and we don't have any record of it, it's very, very hard to defend yourself in a situation like that. So in order to provide systems of work that are planned, organized, performed, maintained, and revised as appropriate so as to be safe and risk-free. I'm not going to go through all of these guys, but common sense kicks in here. I'll just give you some of the highlights. To provide protective clothing and equipment where risks cannot be eliminated or adequately controlled. To prepare and revise emergency plans and procedures. To obtain where necessary services of a competent person for the purpose of ensuring safety and health at work. And to ensure all measures taken into account, both fixed term and temporary workers, are applicable to them, and that any measures taken do not involve financial cost to any employee, i.e., unfortunately, the employer has to bear the financial hardship for that. So obviously, I'm sure everybody knows, but in the event of training, all staff need to be paid for training, even if they're not scheduled to work a shift thereafter. So I suppose how to approach health and safety risk management. Believe it or not, it starts with the risk assessment. A lot of people say to me, "Oh, I don't have a safety statement," and you're kind of like, "Well, it doesn't start your safety statement. It starts with your risk assessment." So I suppose, what is it? It's a systematic process to identify hazards. It evaluates risks associated with those hazards. The aim is to implement control measures and review and update regularly. Now, this is the big question. People say to me, when do I review and when do I update? So I suppose the genuine answer is you should be reviewing your risk assessment annually, at least. Updates regularly. If you have a store revamp, that's a massive one, or a store refit. Unfortunately, even though your processes may not have changed, if you change your processes may not have changed, you might move your aisles in a certain direction, or you may add a service that does require a new risk assessment, because your flow of the store is dictated in your risk assessment. And if you change that flow, that does need a review, unfortunately. Otherwise speaking, you should do that on an annual basis. And if there is any changes like a machinery update, if you change a baler, for example, if you're on a retail site, if you change the position of maybe your fire drills, are you carrying them out? How often are you doing them? Things like that. They all need to be reviewed and updated as part of your fire risk assessment as well. So just review and do them, and make sure that everybody carries out an evacuation at least once a year. That is a requirement of your insurance that an awful lot of people aren't aware of. The safety statement then is a written document outlining company safety policy. It must identify hazards and assess risks. So that's where part one of your risk assessment comes in. You can't identify them without carrying out a risk assessment first. It must be accessible to employees. What we recommend is when you get your safety statement updated or constructed, depending on whichever way you are at the moment, simply send them out a copy of that with a payslip. PDF it, stick it in with a payslip. And at least then you can screenshot the delivery receipt. And if there's ever an issue, well, I gave it to you and I sent to you on this date. Again, safety statement reviewed annually or when changes occur. Third strand here is transfer of information to employees and contractors. So ensure staff inductions include health and safety arrangements in place, including contractors. Ensure the safety statement is accessible to all staff. Again, you can email it. What we also recommend is if you have a staff canteen or something like that, putting a copy in there, and making sure the staff are aware of it. Continuous staff training on health and safety awareness within their own role, and consult with employees on safety matters. Again, buy-in from the employees is huge. Sometimes they can give you the best ideas on how to make an area safer or make your store safer, because they're the ones actively working the floor every day or that area on a daily basis. So they're sometimes the best people to tell you how things might be changed for the better. So don't be afraid to consult with them, and even maybe on a 6-monthly basis like that, just to bring them all together and ask them for any ideas. Because if you get buy-in and you are seen to be reacting to their ideas with positivity, you'll find the day will become a lot more safety conscious, and that they will actually drive the culture for you within the business, which is the ultimate aim. So again, just to focus a little bit on the risk assessment, because again, this is the big thing we always find. It helps the business identify hazards, understand the level of risk, and decide what controls are needed to keep people safe. So again, now what I always get asked is, how do I identify the hazards? I suppose that literally depends on your retail environment. Based on our research and what we do with our clients, biggest risks for employees in the retail environment are slip, trip, and fall, fire safety, or unfortunately, it's a new one, relatively speaking, is customer violence and aggression. So you have to put controls in place to ensure that your staff are kept safe. So the hazard is anything that has the potential to cause harm. Could be specialized or complicated machine, or as common as a hot drink. If it can be harmful in any way, then it's a hazard, unfortunately. So the risk then is the combination of the likelihood of the event occurring and the consequence of that event. So obviously, if someone has a minor accident, like a hot drink where they burn their hand, hopefully it doesn't happen, but that's unlikely to kill them. But if someone was to fall down the stairs, maybe 8 or 9 steps backwards, that has obviously got a lot higher risk, and the consequence of that event would you would believe to be a lot more serious. Then obviously the control measures. So they're the actions taken to remove or reduce the potential of exposure to the hazard and the level of risk. Now we're going to move on to the hierarchy of controls in a couple of slides, but sometimes it's not possible to eliminate the risk completely. You can only make it as safe as you possibly can, which we'll move on to. The hierarchy of controls are your most effective to the least effective from top to bottom. So as you can see, I'm sure you've all seen this in some way, shape, or form before, but the number one thing we can do obviously would be to physically remove the hazard, which is elimination. Now, again, practically, sometimes that is impossible. Most of the time, it is impossible. Sometimes what we can do is substitution, so we can replace the hazard. So that can be especially effective if you're dealing with machinery or anything like that. Sometimes you can swap something out and make it a little bit safer, or you could introduce a new machine and put in more guards, stuff like that. Isolation. So sometimes it's isolating people from the hazard. So only who really needs to be doing that job will do that job. So if it's something that might need to be specifically trained, you just ensure that that is the only person that deals with that issue, that you keep the rest of your staff away from it. Engineering controls. So sometimes the engineer at the hazard, again, that's not always possible. Administrative controls has changed the way people work. Again, that is relatively speaking quite difficult to do. Sometimes it could be the case of if someone is diagnosed with a condition, for example, epilepsy is a big one, that you may not have them in areas where there may be soft or low lighting, or lighting may change on a frequent basis. PPE, obviously, it's the least effective, but sometimes it's the only effectiveness that we can give is to provide the worker with personal protective equipment. Just bear in mind that PPE should be supplied by the employer, and no cost should be borne on the employee on the back of asking for PPE to be implemented within the workplace. I suppose here is an example of a risk assessment. Again, the hazard, we're not really going to worry about what the risk assessment is. The risk is basically it can be fire, arson, explosion, entrapment, fire spread, burns, fatality, smoke, installation, delayed response, delayed evacuation, confusion, panic, non-compliance. So again, if you look under our current control, so fire extinguishers serviced by a competent company every 12 months, fire alarm panel every 3 months, emergency lighting units serviced by a competent company, break glass units, 2 fire drills conducted every year, all staff involved in a drill, findings recorded and correctives addressed. Fire evacuation plan procedures are documented and communicated to the team. Roles are assigned to aid responses. Only authorized competent electricians are permitted to access work on electrical panels. So that was the current controls on that risk assessment. The new controls then that we would be implementing would be emergency lighting to be serviced, completed every 3 months, records kept in file, a fire logbook, which would include service and maintenance records, a plan in place for dealing with people of limited mobility, hearing, vision. So that could be our employees with extra needs. A weekly break glass test unit to be completed and recorded. PAT testing and regular visual inspections carried out on all portable electronic equipment on site. A sign-in procedure in place and captures commence and end times of works on site. Documents used to complete roll call at assembly point. Permit system in place for hot or electrical works. Firefighting equipment to be kept clear of obstruction. Combustible flammable materials stored in designated areas. Staff trained in fire safety awareness. Designated staff are trained as fire wardens. So again, these are all extra controls that you could put in, and obviously, as you can see, that would bring your risk rating from A to B, and lower your risk on site. Obviously, down below, then in our risk assessment under the action plan and photos, you have options to upload certs and things like that for your fire awareness courses and your fire warden courses as well. You can also display things there like your maintenance records and stuff like that on our portal. So again, cuts out the need for paper and digitalizes through the sea change solution. Section 4, top workplace risk. So in this unfortunate scenario, we have this poor employee who's burnt herself using a coffee machine. Again, very nasty. injury, that would obviously lead to a claim, hike insurance costs, cause staff disruption, especially in a busy retail environment like a coffee shop or cafe. Most accidents involve, unfortunately, slip, trip, and fall, manual handling, vehicles or forklifts, equipment, and poor procedures. So I'm sure we've all got experience in dealing with these. Slip, trip, and fall is the most common one. SeaChange clients last year, we reported about 8,000 slip, trip, and falls across our sites. So again, very common occurrence. Manual handling accidents, they are preventable, put the training in place. Vehicles and forklifts, that can a lot of time be down to driver error, but sometimes mechanical issues. Implementing checks to cover them vehicles or forklifts is also quite important. Equipment checks, again, maintenance records, daily checks before use at the end of the day. Poor procedures, again, training, certification, staff awareness, and obviously enforcement of policies that employers have outlined as well. So I suppose what I'd like you to do in your heads, obviously we're not here in a face-to-face, but identify 3 major risks in your business and how you control them. So maybe following this, what we ask everybody to do is identify your major risks in your business. For us, from a retail perspective, slips and trips, manual handling, and forklifts are massive. For some sectors that don't have forklifts, I'd be saying things like combi units, serious cause of accidents in the retail sector at the moment, and also hand pallet trucks for anybody that's using them to move stock around. They're also causing an awful lot of injuries amongst the general public. It's just staff not using them properly, hitting off people, especially young kids. Under 14s are actually the highest risk in any public setting in terms of being hit or slip, trip, and fall at the moment. A lot of people think it's actually adults, it's actually moved to kids. So just bear that in mind as well. I know it's an awful lot of retail stores now. They have a policy that no under 12s are allowed in without an adult. It's just something to consider. We're not saying it's right, we're not saying it's wrong. It's just an awful lot of businesses seem to have implemented that. Under 12s, not on their own without a parent. So again, we're going to reinsure hierarchy of controls. I'm putting this in again purely to, I suppose, highlight the seriousness of it. Least effective PPE, most effective is elimination. Most people fall in the middle. Just bear in mind, I'm going to leave it up there for 30 seconds. If anybody wants to take a screenshot or anything of that or take a photo, you can use that for your own record. But again, PPE is least effective, elimination is the best. But as I said, most people fall into kind of isolation or engineering controls. So I'm going to move on beyond that. I hope everybody's taking a photo if they want to. Okay, so fifth section is compliance versus safety culture. So I suppose this is where SeaChange speak about safety culture. It's all well and good saying I'm ticking all the boxes, but have you got staff buy-in and are you actively promoting safety in your workplace? That's what we aim to promote. So I suppose what is safety culture? So we have the safety climate, again, our iceberg illusion here, and then we have safety culture below the surface. So the product of individual and group values, attitudes, perceptions, competencies, and patterns of behavior that determine the commitment to and style and proficiency of an organization's health and safety management. Safety culture defines what people do when no one is watching. You might be familiar with Peter Drucker. He's a very good strategist. He says that culture eats strategy for breakfast. So, i.e., if you don't have a good culture, you're never going to be able to progress, even with the best strategy in the world. So you have to ingrain that culture within your employees. So I suppose we always find there's a 15-70-15 model in health and safety attitudes. 15% of people are typically negative and defensive. 70% are like, okay, we'll do it if we have to. And 15% are actually kind of positive and willing to help themselves and others. I suppose SeaChange solutions shift the middle 70% of the workforce safety culture to the right, leading to increased safety ownership and reduced accidents. We build trust, value, and local ownership. How do we do it? We do it through making it visual and interactive, behavior-based, involving employees from the ground up. And I suppose we always say that habits are safer than rules and treat employees as part of the solution. They're not the problem. So I suppose the SeaChange solutions target human factors below the surface. So the way we say we get things done is through structure, risk compliance, and behaviors. So the way we really get things done is through conviction, belief, attitude, values, motivation, and identities. And that's where you need buy-in, as I said, to start from the top down. If the message isn't coming from the top, it will not get done. Cannot stress that enough. So I suppose compliance versus safety culture. So I suppose compliance is having your paperwork, doing your inspections, following the rules. Great.
So what's culture? What's the difference? So it's behavior. So that people choose to do the right thing every day. Ownership, that they own the environment they're in. They're there to make sure they're going to keep themselves safe. And they walk in at 9 o'clock traditionally in the morning. They're going to walk out at 5, 6, 7 in the evening. They're going to be in the same shape as when they walked in the door. That's what you want. Good cultural behavior, good ownership. And obviously, again, top down has to be led by example from managers, owner, operators. The difference between a safe business and a lucky one, it isn't about did we get lucky today that no one fell? No, it's because we've ingrained it in the staff. Safety matters, and they know what to do in any given situation. So I suppose business requirements. Every business needs core management safety system, legally required, unfortunately. A safety statement, risk assessment, staff training, incident reporting, regular reviews. Staff training, I suppose that focuses on there. We've done safety statements, we've done risk assessments. Staff training is basically in relation to fire safety, manual handling, first aid. What's obviously coming in now as well is dignity and respect at work training, violence and aggression. That bill is going through the Dáil at the moment. Obviously, you might have all have heard the ads on the radio about the HSA enforcing that as well, that if someone feels intimidated in the workplace, it is the employer's responsibility to reduce that risk. So again, that should be addressed in your regular risk assessments and staff training as well. Incident reporting, obviously any accident that happens in the workplace, if the person is out of work for more than 3 days, an ambulance is called or they require hospitalization, it has to be reported to the HSA. Unfortunately, in that incident, you are likely to get a HSA inspection. It's not guaranteed, but it is likely to happen. So just be prepared for that. But it's worse not to report it and have it found out than, because what they do in the hospital now is if it's a workplace accident, they actually give them a form to fill up and they're legally obliged to pass that on. So you don't want them beating you to that. So make sure you do comply. I suppose leadership from a health and safety viewpoint, leadership regularly. When I say leaders, this can be managers, it can be owner operators. Depends on the scenario. They should regularly walk the workplace, talk to staff, check hazards, review incidents, follow up actions. This takes 15 minutes a week. So that's our check and inspect system. As you can see, little brief photo there, 10 scheduled checklists. Completed checklist for the day is for 52% there, 48% not completed. It's a great way of highlighting what you're doing from a health and safety viewpoint, especially good in a multi-store setting as well. If you have multiple sites, you can actually see what's happening on each individual site. And obviously our system brings it all together so you can rank stores in terms of effectiveness, rating, so on and so forth as well. Who's top of the leaderboard, who's compiling the most checklists, and likewise it allows you, as the owner, operator, managers, to identify what hazards are in the store and how to make that safer. As I said, 15 minutes a week, we're looking at, 3 minutes a day. So the Sea Change Safety Culture Growth Model, this is something that actually the company was founded on. How did we become to exist? So I suppose there's two attitudes. We have the left and the right. So the left, I follow the rules because I have to. And the other side, I follow the rules because I want to. So obviously, most clients who come on board with us, they're on the blue side. The aim is to get over to the green side. I suppose that's basically the culture model, how it works. So as you can see, in phase 1, the health and safety is random. It's instinctive. It's more reactive rather than being proactive. That's generally where we get clients in, or there's been an accident. Phase 2 then, it's box ticking and policing. So we begin then to maybe implement checklists, some routines, and we check it every now and again. So you begin to move on to phase 2. Phase 3 is where you see the change begin to happen. So we introduce routines and we create new habits amongst the workforce. Things are beginning to look up at this point. Phase 4 then, it's the results and the engagement. So what you find is you're having less accidents, less LTIs, less reportable instances. You're getting engagement from staff, they're buying in, they're looking to get training, they're being proactive. And the final step then is that it's gone sustainable and it's gone accountable. So that's basically the point at which I suppose everybody's doing their job on an active basis. The dream scenario, really. Very few companies reach level 5, unfortunately, but we have got some success stories there in that. Most of our clients will end up between 3 and 4. So I suppose making health and safety routines work for you. So best practices in the retail environment, walk the workplace, get out and about, look at your floor space, look at what's going on, talk to staff, ask them about issues. As I said, sometimes the staff will give you the best issues. Encourage reporting. One thing we discourage is this X amount of days without an accident. That's non-beneficial to anybody. because what it does is it just causes people not to report any instances that do occur. They don't want to be the one to break that magic number. Fix health and safety issues quickly and lead by example. So again, top down, can't say that enough today. Leadership needs to be set here. Examples come from the top. So pitfalls of ineffective health and safety routine. So examples are ignoring hazards, rushing work, blaming staff, treating safety as paperwork. Oh God, it's another box to tick, it's another form to fill in, it's all red tape. That's ineffective. You're not using your time wisely. There's lots of solutions out there that we offer, digital and otherwise, make that paperwork very, very simple, very, very clean. And as I said, 15 minutes a week. So I suppose key takeaways where we're getting to the end here. Safety management means caring for people, managing risk, protecting the business and setting the example. Good safety leadership prevents accidents, incidents, and ultimately puts money back in your pocket through lower premiums, less claims, less LTIs, less staff absences, more productivity, increased bottom line. So I suppose sea change very quickly. We're the one-stop shop for health and safety. We've two parts. So we have a bespoke health and safety system. We do a risk assessment and RACAP report. Now, the RACAP report actually stands for Risk Assessment Corrective Action Plan. So it's basically identifying your risks, your current procedures, and then implementing the new control measures as we discussed earlier on. Obviously, the safety statement. We have a visual risk management system, and we also provide site safety champion training and certification. You might know them as a health and safety officer, health and safety representative. We just call them a sea change champion. Part B is our health and safety support partnership. So we provide a client portal where you can access all your documentation, your risk assessments are online, your safety statement and risk assessments are there. We also update your documentation for you. Sabre safety cultural audit. So your traditional health and safety audit focuses on your documentation. Our Sabre element focuses on your documentation, but we also talk to staff about how health and safety is perceived through their eyes. So we might ask random people certain questions as we go throughout the audit. And that we can actually grade that by combining the two scores. So sometimes what we find is people score very well in documentation, but then on communication through the staff, their score is lowered significantly because it's not communicated correctly. And obviously then we have partner rates for health and safety training and deliverables as well. I suppose we partner with client sites to provide bespoke behavior-based safety solutions. Our team provides visual systems, digital apps, ongoing support, staff training, and audits to ensure our clients continue to manage risk, accidents, and claims effectively. That's the end of the presentation, guys. Where I think we have a few minutes left, Keelan. If anybody wants to ask a question, or if you would like to get in touch with me directly, my details are there. I will be aiming to contact you all to have a chat on a one-to-one basis. We will be available to call out if anybody would like to have a chat on a one-to-one basis or have a look at what they're currently doing. Thanks very much for your time today, and I'll pass it back to Keelan.
Thanks, Eamon. No, that was very interesting. Lots of points throughout it that I was like, oh, didn't know that, or must look at that again. So definitely worthwhile. Just the racking certified companies, Eamon said there was two available. Do you know off the top of your head?
Yeah, there's one based in Cavan, one based in Cork. So
Okay.
there's one in the north of the country, one in the south of the country. You will get some independent auditors there, Keelan. We do have some preferred suppliers, which we can pass on as well, if anybody wishes to request that information.
Okay. And is it the SARI certified?
Yes, correct.
Is that what you're looking for? Yeah.
Yeah, correct.
Grand, yeah. I see a few on Google there as well. So
yeah.
Yeah, cool. We might chat about them and pass them on. If anyone else has any questions, feel free to throw them in there now. We'll ask Eamon. Just the other question, Eamon, it was around the dignity at work, and obviously all the antisocial behaviour that's going on in
the violence
retail.
and aggression bill. Yeah, absolutely.
Yeah. From your perspective, what are you recommending that staff get trained up in how to handle it? Is it?
We do conduct that. It is a risk assessment that has to be labelled as part of your risk assessment now is violence and aggressive behaviour towards staff members. So what control measures have we put in place? And I suppose that's where a document called an emergency response plan can come in as well. So an awful lot of businesses would have an emergency response plan in relation to fire, storm, stuff like that. But what we're finding now is that violence and aggression also needs to be managed within that document as well. So I suppose that is another element that you need to include in your safety plan moving forward as well, is getting that training in place and ensuring that the protocols, in the event that someone is verbally abused or physically abused, that other staff members know what to do. And some sometimes the right thing, what seems like the right thing is the wrong thing to do. So obviously, if you see a staff member or colleague maybe getting physically abused or verbally abused, your first instinct might be to rush in and help them. But sometimes it's actually better just to step back, because you can only exacerbate the situation maybe, or you could inflame it, and cause more stress, more anxiety. And a lot of people sometimes try and step in to try and mediate between the parties, but again, that can lead to increased violence or increased aggression. So it's about having the correct protocols in place. I suppose another thing, Keelan, there in relation to that is shoplifting as well. Some people do believe that they should confront the person if they believe they're taking something. Again, there is strict protocols there, because that is another cause of violence and aggression towards staff members. So ensure in your risk assessment as well, guys, that you have a policy in relation to shoplifting, and what exactly that does contain as well.
Yeah, I think that's a double-edged sword, Eamon.
Absolutely.
You can see it from the other
some
side.
of the policies, the bigger changes are put in place in relation to that, but we won't get into that today.
Yeah, because if you don't challenge them, they'll come back tomorrow and they'll rob twice as much.
Absolutely. But we do provide training in relation to that as well. So if anybody is interested in that, we do actually have training in relation to shoplifting prevention and how to deal with that situation as well. Because I know that is common nationwide at this stage. So yeah, that's fine.
Cool. That's cool. Okay, Eamon, I don't see anything more. Let me just triple check. Yeah. Is there a preferential rate? There would be, Eamon. You will definitely look after members.
Absolutely. Listen, guys, we have a standardized pricing system, but we'll take 10% off for REI members. That's no problem at all. I'm happy to give that. No problem at all.
Okay, perfect. We'll leave it there, folks. Thanks, Eamon.
Thank you very much.
All right, folks, we'll leave it there. Thanks. We'll talk to you again. I'll end there now.